record to the cloud. All right. Welcome back, everyone, to Build Your Bones. We're excited you're back for another session in this week in this series for our multi-state implementation of Build Your Bones. And we are an equal opportunity institution. And I'm going to pass it over to Melanie to introduce today's session. Melanie?
Hello, everyone. Thank you for joining us today. My name is Melanie Sutherland with UF IPES Extension, and presenting with me today is Amber Hughes from Penn State Extension. So today we're on lesson 6, and we're going to talk about fall prevention and balance. Okay, so before we get into today's topic, let's recap so far what we've talked about. So we've discussed your personal risk factors, testing for osteoporosis, medications and supplements. We've discussed how important good nutrition is, not only for your bone health, but for your overall health. And so now we're going to focus our time on staying strong. So think about that phrase, staying strong. What comes to mind? What do you picture, and how do you fit into that picture? Feel free to share in the chat box if you would like to. But what does staying strong mean to you? And I'll give you a few moments to type into the chat if you would like to share. Okay. Being active, being able to do what I want to do or need to do. Absolutely. Being able to lift myself up. Being healthy and exercising. Not getting broken bones, mobility with ease. I like that. Okay. Thank you all for sharing. So keep that picture in your mind as we go throughout today's lesson. Okay, so staying strong is achieved through physical activity and that is how we maintain our strength. You know, that's important for our bone health and our overall health. And maintaining independence includes focusing on posture, alignment, and improving your balance, avoiding falls, being safe in your home, and feeling an overall feeling of security within your physical status. Today's focus is on posture and alignment, balance, maintaining independence, maintaining strength and flexibility. So let's talk about posture. So posture is how you position your body while standing, sitting, bending, reaching, and doing other tasks. So improving or maintaining posture may help reduce rounded sloping shoulders, reduce the chance of fractures of the spine, and can reduce pain. Poor posture and alignment can add stress to both your bones and your muscles. Good or improved posture can help reduce pain from arthritis too. So good posture is important for everyone. You want to stand and sit straight to the best of your ability. You know, think right now, how are you sitting now? Can you make some improvements? What do you think? Are you slumped over a bit? Are your shoulders rounded? How could you improve? So let's think about this as well. How might your life change if you fail? Do you know anyone that had trouble recovering from a fall?
Melanie, nobody has answered anything, but I'll share that when my mother had a fall, she wouldn't go back to that room. She fell in the kitchen and she would not go back to the kitchen because she had that fear of falling again. So now there's a couple of things dropping in: limited mobility, not being able to be active again, might be a burden on my family. So, yeah, there's a lot of different things.
Yeah, and that's really common, you know. Thank you for sharing. So, as we heard, a fall can have a big impact on your life. So besides the potential for pain, broken bones, or even a head injury, falls can cause permanent or temporary disability. They can cost you a lot of money, your insurance company a lot of money. They can increase your dependence on others. And this dependence might be, you know, your family members, or it may require hiring someone to assist you in your daily activities. The inability to get around like before tends to isolate people from their friends and their family. And another consequence of a fall is the fear of another fall, an additional injury from the fall. And last but certainly not least is death. You know, people die from falls, especially older adults, and traumatic brain injury can occur due to a fall. And that actually accounts for about 1/2 of deaths, due to falls. So think about the quality of life. After a fall, it can really change dramatically. So older adults are more likely to fall, but falls can happen at any age. About 1/3 of people over the age of 65 fall each year. And of those over 80, half fall. An injury may or may not occur with a fall. That's why one of our major goals of this series is to help you reduce your risk of falling. By incorporating balance exercises and other physical activity into your daily routine, you can reduce your risk. If you do fall, it is really important to tell your healthcare provider so you can discuss how you can prevent future falls. One of the greatest risks of a fall is a previous fall. And so don't wait until you fall to take action. Many people who fall do not recover to their previous capabilities. People with weakened bones are certainly more susceptible to injury. Remember from a previous lesson that poor bone health can happen at any age. Falls, especially hip fractures among older adults, can be devastating and can start a downward spiral in health. So you may have fallen or know someone who has, like we talked about earlier, but what are some reasons you think people fall?
We did have someone share in the chat and said that they were a runner and just did silly things like, you know, tripping over your own feet. I know when I get new shoes, sometimes I tend to trip. But that was one example. Then rushing, slippery floor, some clutter in the home, wet cement. Yeah, all of those are great examples. And then one that our colleague Julie England used to say, you know, it's those furry speed bumps we have in our home that move around a little bit. Yep, our lovely animals.
Yep.
There was also one that said one of her physicians told her to get rid of scatter rugs, which are very notorious for tripping people as well.
So a lot of these we could prevent, right? So let's talk about some risk factors here for falling. So these are some causes of falls, but certainly not all. And when we look at the concept of staying strong, it may mean different things to different people. So there are certain things we can't change and others that we can, of course, like anything else in life. But let's focus on what we can change and make improvements to stay strong and reduce our risk of falling. Okay. All right, and so let's talk about the fear of falling. It's a vicious cycle. It's an interesting concept that being afraid you will fall is also a risk factor for additional falls. Even if not injured, falls can lead to activity restriction, reduced physical activity, inability, isolation, and depression. Being concerned about falling is helpful when it reminds people of using safe behaviors, such as not using a chair to climb to reach items in the home. But fear of falling may cause people to quit doing everyday activities and the things that they enjoy. Restricting activities can lead to a decline in other abilities, which can then increase the risk of falling and then an increased fear of falling. So this loss of ability also may lead to loss of independence and quality of life. Okay. Amber, I'm going to pass it over to you.
Perfect. Thank you, Melanie. So now that Melanie has told us a little bit about the statistics of falling, some of those risk factors that can lead to falls, and some of the causes of falling, we're going to talk a little bit more about how we can improve and work on or prevent some of those falls a little bit more in our environments. So we'll talk a little bit about balance. So balance is something that changes slowly over time, and it's something that we may not notice as we age and we get older. So I was surprised to learn that balance actually starts to decline when we're in our 40s. Unfortunately, when we're younger, our reflexes are a little bit quicker. They're able to compensate for a sudden loss of balance. But as we age, it's unfortunate, but those reflexes also tend to slow down as well, so they can't compensate for that. So maintaining or improving your balance as we age is really going to help us in our efforts to avoid falls and to work on our goal of staying strong as we age. So you'll notice that in each lesson that we've had, we've been practicing and offering different activities, different exercises to help improve our balance and strength. Generally, for most, these exercises are probably fairly easy and simple. So it's also really easy and simple to try to incorporate them into your everyday life. But as you improve on those easy and simple exercises, you can try to find ways to make them a little bit more challenging, or maybe hold some of those postures for a little bit longer. All right, next slide. All right, so a couple of tips when it comes to exercise and how we can use exercise as a tool to help us improve our balance. Really want to focus on getting that exercise and balance exercises in particular in every day. So does anyone have any sort of suggestions on how we can squeeze some balance exercises into our everyday routines? Feel free to put it in the chat. I know there's a little bit of a delay because I just posed the question to you all. How can we fit balance exercises into our everyday routines? I know one little trick that I use is even when I'm brushing my teeth at night, we brush teeth for about, a couple of minutes, even just to try alternating standing on one leg. I've got the counter right there to help me if I feel a little shaky or unsteady, but that's a good way to try to squeeze it in.
We got some good suggestions in the chat.
Yeah. So standing on one foot, I'm not the only one that stands on one foot while I'm brushing teeth. So thank you for that one. While the Keurig's making coffee in the morning, that's a good time to, while you're waiting there, just waiting for that coffee to brew, perfect time to sneak those exercises in. Same time of day, routine is key, right? Our minds are programmed to do it that same time every day. That's going to make it easier to sneak it in. So setting that alarm is going to be a great way to make sure you're fitting those exercises in. I mean, even watching TV, you can work on some of those poses, those exercises during commercials. That's a good way to sneak in some exercises without having to sacrifice anything too significant. Zoom classes. Yeah, there are quite a few different like Tai Chi classes or other balance focused classes out there that, thanks to one thing with the pandemic is that a lot of them became virtual. So that was open to a lot more people and participants. But yeah, all great suggestions. Thank you for sharing, and feel free to keep putting them into the chat if you think of them, because the more brainstorming on how we can squeeze those exercises in during the day, the better. So some of those exercises can actually do double duty for improving both our strength and balance while you're giving us some exercise. So even walking, running, at one point you're shifting that weight from one side to the other. So still working on balance for that. So anything that's really going to help improve the strength of that lower body is probably going to help aid in balance as well. So when we talk about avoiding falls, we can do balance exercises all the time. We can take care of ourselves, follow all these strategies and techniques and tips to a T. But unfortunately, falls can still occur. We can do our best, but they are still a possibility. So you're taking those preventative steps to try to reduce your risk of falling, but also reducing your risk for having serious injury from those falls, like possibly a fracture. So if you have weakened bones, it's really important to take those steps to help avoid falls by having your vision checked annually, discussing your medication, reviewing your medications with your healthcare provider or your pharmacist, especially if you're experiencing any sort of problems with dizziness. When it comes to medications, pharmacists and doctors can really work on adjusting the levels of those medications as needed to try to prevent dizziness. So be sure that you're being honest and forthcoming with that if you are experiencing dizziness. Some people might want to consider having a home medical alert device. These devices, if you're not familiar with them, can help you contact emergency assistance if needed, if you do have a fall. One important thing is that you'll have to keep that device with you at all times. I know that my grandmother actually had one of these devices because she was having some falls in her home, and it was really a lifesaver, quite literally, because she was able to get that emergency assistance right when she needed it if she fell. So many of falls can occur in the home, but they also can happen in other environments as well. So again, if you do have that medical device, just making sure that's with you at all times. And so we'll talk a little bit on this next slide, since we have a lot of obstacles even in our homes and environments that we're used to. We're going to take a peek at some of these pictures and think about some of those things even around your home. If you're home right now listening to us, sitting in your chair, maybe taking a push back from the table, the desk, or wherever you're joining us from, just looking around the room and seeing if you can identify things around you that could be considered fall risk. And feel free again to put it in the chat. But we'll kind of walk through some of these pictures. When we're looking at that picture on the top left there, that person that's on a ladder, what are some things when we're on a ladder that may lead to a fall? I know I'm a little scared of heights, so if it's a high ladder, that's already going to have me a little nervous and shaky to begin with. But yeah, leaning. Someone already pointed out that furry speed bump. Thanks, Wendy. Yep, that furry speed bump too is right in the middle there. But yeah, someone's leaning over the ladder, kind of reaching out instead of staying closer to their area. That's gonna certainly increase that risk of falling. How about any other problems? Maybe someone's unsteady on their feet. Maybe they're not quite so good with their balance on the ground, on a stable ground. Probably getting them up in a ladder isn't going to be the best idea. So, and if we think about anything really, sometimes step stools, it doesn't even have to be as tall as a ladder, but even a step stool might have legs that are a little bit rickety, a little rocky. So again, just being sure that whatever you have for that balance underneath you is as stable as it can be on as flat of a surface as it can be. And you're really staying within your comfort zone to prevent falls, whether you're up in the air on a ladder or even just a couple inches off the ground there. We got those furry speed bumps that were mentioned earlier. Our pets, we love them. That's why we have them. I know I've got 2 dogs at home that are like big black bumps on the ground sometimes. So in the middle of the night, if we get up, those 2 black bumps, they're hard to see in the dark. So certainly there have been times where I kind of stumble into them, but they certainly can be pretty big fall risk or obstacles as well. Wires or cords that we stretch out, maybe you have an outlet on one side of the room and you're stretching out or running that extension cord or that cord across the room to a lamp, a TV. though that's something that could easily be a fall risk as well. I know there have been some buildings I work at where instead of having that loose wire, that loose cord, they might duct tape it down to the ground. So at least it's a little bump, but it's always that little bump that's in the same spot. So people kind of get used to it a little bit more. And then just coming down the stairs. I mean, I know there's been times when I'm coming down our stairs at home and I've got a laundry basket of laundry and I'm looking to take that to our laundry room, but I lose sight of those stairs underneath me. And, you know, that's certainly something that everyone, I'm sure, has issues at there. They've had their hands full when they're coming down the stairs and just mind is a million other places and they just lose sight of the steps. They're not really thinking as they're walking. And before you know it, you might fall down those stairs. Laundry, dirty clothes all around you, in my case, if you're doing laundry. So really trying to be sure that we're being cognizant and we're focusing on the tasks that we are trying to do, such as walking down the stairs. So if any of this looks familiar to you, just know that you're not alone and there are ways to just improve or just be more aware of these potential fall risks in your home. I know that our chat's been pretty active. I haven't been able to keep up, but thank you everyone for the conversation and the stories that you're sharing in the chat. So really, really good to hear all that input or see all that input, I should say. All right, so I talked a little bit about some of these strategies already, but there really are a lot of different things, options you can do to reduce your fall risk, whether you're at home or you're someplace away. One thing that we may see or be familiar with are canes and walkers or any sort of walking devices. So a lot of times if that has been recommended for you temporarily, maybe you had knee surgery or hip surgery, and you get sent home after that surgery with the recommendation to have like a four-wheeled walker or even a cane, you'll want to take that recommendation to heart and be sure you're using that device because that certainly is going to help reduce your risk for a fall. And it might be something that might be a short term as you're regaining that strength in your lower body, or it might be something that's recommended for the long haul. Get rid of clutter. If ever there was a good excuse to organize your place, have this be it. So really try to declutter that home. You know, if you got stacks of magazines, if you're someone that has newspapers, you know, a couple of rugs that maybe are piled up or just, you know, clothes, good time to really take that time to organize everything, fold it up and try to put it in its proper place. Really think about your home and how it's arranged. Are there those throw rugs that might cause you to trip, especially in the middle of the night if you're getting up? Is there anything laying around on the floor? Do you have blankets on the floor? Do you have pillows on the floor that just fall off the couch or get pulled off the couch every once in a while? Those electrical cords, are there any rooms where you might have some of those electrical cords that are running across the room? Poor lighting, that might be another thing too that we don't always think of, but is there somewhere where the lighting is a little bit dimmer, it's a little bit harder to see your step or see if there's clutter or other things on the floor? Again, I think nighttime, when we get up, that can be tricky because it's dark. So if you can find a way to put lights that come on as motion activated lights, I think they're called, as you walk past them, they turn on. That can be a great way to provide some light for you when you're getting up in the middle of the night without having to leave lights on the entire night. So we really want to challenge you this week. And again, you can keep putting things into the chat if you'd like to, if you have things off the top of your head that you know, like, oh man, I really should probably work on that. But this week, before we meet now for our last session next Tuesday, really think about doing a hazard hunt. You know, look around your house with an objective eye and really try to see it from an outsider's view on what might be fall risk and what are some things that you can do to improve that fall risk to help prevent falls. And like I said, you guys are doing great in the chat. It's always a good time to spring clean, I see Wendy says, even though it's getting to be fall in my neck of the woods. But really, like I said, take a good look at your house, the environment, and anything that you can do to try to prevent falls. Right, next slide, thanks. So again, we'll do as much as we can to prevent falls, but we really want to go over and discuss a little bit about what happens if you do fall. Because it's one thing to prevent, but if it happens, we don't want you or your loved ones to be completely unsure what to do or how to respond or react. So the first thing you want to do, first and foremost, is try not to panic. Take a few deep breaths, which can be really tricky. You find yourself in a position you weren't planning to be in, but really try to take that time, take a few deep breaths in through the nose and out through the mouth, and just stay still for a few minutes. And again, let your body relax and come down off that adrenaline rush of falling, because once you come down from that, your body will likely tell you if there's something that has been injured. That's when your body might register some pain if there's anything that has been injured. So at that point, you register that pain. If you think that you might have a broken bone or any other injury, like a fracture, that's not the time to necessarily diagnose this, but just be sure that you are able to identify that pain and maybe where it's coming from. If you register pain, be sure you do not get up. Do not attempt to get up, because you may do more damage to that injury trying to get up than trying to stay down on the floor and get help that way. So if you are feeling pain, we want you to try to yell for help if you live with someone else, or even if you have to crawl to the telephone and call for help. If you have that life alert device around your neck, this is the perfect time when you can use that and just stay still in that space without having to move at all. One other thing while you're doing that hazard hunt in your house too, you might want to consider where the telephones are. Take a look around and say, okay, if I were to fall in this area, if I were to fall at the bottom of the steps, if you have steps in your house, is there a telephone nearby that I could potentially crawl to or get to if I was feeling a lot of pain? So be sure you're taking that time to register where those telephones are, or if you're someone that has a cell phone that you carry with you, again, just making sure that you are aware of where that phone may be so you can get to it quickly and painlessly. A common place that people fall is often in the bathroom. It's slippery, tiled surfaces. So if you are at risk of falling, or if you are worried about falling in the bathroom, great time to take, again, a cordless phone, if you have a landline still, or your cell phone, and put it somewhere that's easy to reach while you're in the bathroom. We'll talk a little bit more. So now that you've kind of scoped out the area, figured out where there might be a phone nearby, that is kind of what we want you to do, is to crawl, try to resist getting up, because that might do more damage to whatever you've injured. If you have a little bit of pain, but you think you can maybe get up, or if you're not feeling any pain anywhere that's really striking or overwhelming, you can try to get up slowly. And so there are some general procedures on how you can get up from a fall, and the pictures do a really great job of showing those procedures. So you're going to want to roll over onto your side. Try crawling to a chair. Again, so you're not standing up just yet, but you're just trying to get to a chair. Even if it's a little bit further away, you're going to want to try to crawl to a chair that, again, is next to a telephone. Again, so trying to get to that telephone as soon as you can. You're going to want to put your weight on your strongest leg. So if there is one leg that's a little weaker than the other one, maybe you've had surgeries in the past, or it's just a little bit weaker for whatever reason, really want to bear your weight on that strongest leg. You're going to want to pull yourself up while bracing with your arms. So just like that second photo is showing us. And then you're going to want to turn around and sit down slowly and as smoothly as you can into the chair. And then once you're in the chair, that's another great opportunity to take some time, check for visible signs of injury. If you feel a little groggy or dizzy in your head, really important too that you're calling for that emergency assistance, just so you can rule out a possible concussion or any other of those traumatic brain injuries or head injuries that we talked about. But if you are noticing any sort of pain, swelling, bruising, bleeding, or dizziness, Again, you're probably going to want to call 911 immediately so you can get checked out and they can rule out any severe injuries. All right, next slide. And feel free if you have questions too. So this is actually a video of a fall. And again, walking us through a lot of the steps that we just talked through. We tried to work through it and we weren't able to provide the volume for you all today, but we do have the link that I'm thinking Wendy or another one of the chat monitors will hopefully drop into the chat there. But again, it does a really great job of highlighting each of the steps we talked about, really focusing on as soon as you fall, trying to relax and calm down, taking those deep breaths before deciding what your next move should be. Because again, after we fall or we have something unexpected happening to us, you get that hit of adrenaline, which can mask some of the pain that you might be feeling from an injury. So as soon as we're able to relax a little bit and come down off that adrenaline high, that's when our body might start registering pain a little bit more. So really key to just try to relax as much as you can and then trying to figure out how painful a certain area might be and what your capacity is for crawling to a chair nearby, or if you're just going to have to try to reach for a telephone or even yelling for help. Those are all strategies that are going to help you in a fall. So Wendy did a great job of sharing the link in the chat, and I believe she'll send that link out with the notes and handouts from this session as well. So great little video. I think it's about 2 or 3 minutes to watch on those steps that you can do if you fall. All right. So everyone, when we talk about moving safely with osteoporosis, really important to emphasize that everybody has different levels of physical activity. And so our goal for this class and for everybody that's included in this class is to stay strong and be able to enjoy and perform daily activities while also enjoying life. Don't make exercise and physical activity a chore that you have to do. So depending on your individual health and your chronic conditions, such as osteoporosis, you may not be able to engage in aerobic activities. I know we had someone in the chat mention that they were enjoying running, but it was just going to be a little bit too much on their body. And that's okay. But if you can find alternate physical activity methods, that's going to still continue to be beneficial for you as we age. So one thing, again, we really want to focus on here is targeting posture improvement. So improving that posture, your balance, and walking exercises. So you want to be sure that you are discussing your abilities, any sort of limitations you may have with your general healthcare provider. And we can offer a lot of recommendations and ideas here. And again, based on the chat, I think you guys are doing a great job of that. But you'll really want to be sure that you have that clearance from your general practitioner. They might be more specific and they might be able to recommend really specific activities or maybe even working with a physical therapist to help you out. So if you are, or if you ever have gone to a physical therapist, you'll want to be sure that you're being forthcoming with them. Discuss your goals, what level of activity you enjoy doing, or maybe what level of activity you want to get back to doing, and any sort of existing conditions that you may have. You'll be sure that you'll want to ask the therapist or know what their qualifications are. If they've had experience working with people that have had a similar condition as you, whether it's osteoporosis or even any other sort of chronic conditions that exist. And one thing that we do like to note, though, is that just because someone works in a gym or a fitness center doesn't necessarily make them an expert. So you'll want to be sure that you're getting those qualifications, those credentials from individuals who are providing those exercise recommendations. We just want to ensure that you're working with the right person. All right, so something that a lot of us don't think about is something that's as simple as sneezing, something you don't even think of. It could actually injure a vertebrae. And I think that's just crazy, but people who have such weakened bone structure, a simple sneeze or a simple jerk, unexpected turn of the head could actually injure or have it lead to like a fracture of the bone. So with someone who has weakened bones, any small forces can really cause what seems to be a little bit of a excessive injury. So again, just making sure that we're focused and emphasized on that good posture, but also realizing that because of this, if you do have those weakened bones, that you might have to change up some activities. So some things that we might want to think of if you are living with osteoporosis is to try to avoid bending at the waist with straight legs. So always have maybe a little bit of a soft bend in the knee. Any sort of twisting motions, back and forth motions, lifting things over your head can put a little bit more stress on those bones as well. And reaching for things, which sounds kind of silly, but even just reaching and twisting at the same time for things that might be just out of your reach has the potential, if you have weakened bones, to result in a fracture or some other injury. So just being, again, very cognizant of your movements and thinking about them before you just naturally kind of a knee-jerk response to reach for something or bending over to pick up something that you dropped off the floor. And I do believe that there will be a handout that's here on the screen that will probably be included with the handouts that you may have already received for this session. This is the Moving Safely publication, and that's from the National Osteoporosis Foundation. So it has some really great illustrations on all those movements that you might want to avoid and some other strategies and techniques to avoid fractures or any sort of injuries if you are living with osteoporosis. Right. So finally, we're starting to wrap up a little bit here. We want to focus again on staying strong. At the beginning of this class, Melanie asked for what staying strong means to everybody, and you all provided some really great examples, some really great ideas of what staying strong means to you and why it's important to you as we age. So really focusing on how you can stay strong. Taking those steps to maintain your independence, doing the things that you enjoy. I know a lot of people mentioned that when they were talking about staying strong, is just retaining that independence for as long as you can. Think about your posture, really trying to incorporate those balance exercises daily. Like I had mentioned, brushing your teeth at the end of the day and even trying to stand on one foot for maybe 30 seconds at a time. Keeps your brain a little bit busy too while you're doing something pretty routine like brushing your teeth. So if you're able to incorporate those things we talked about today, those balance exercises, looking around your house and doing that home hazard hunt, looking and trying to eliminate some of those fall hazards that exist in your home, installing safety features. We didn't touch too much on that, but if you do need some sort of rails like guardrails to attach in your bathroom. Sometimes you see these in bathtubs to help people get themselves out of the bathtub or the shower. Really think about some of those things that are going to be helpful and beneficial for you in the areas that make sense. And again, taking those steps to really protect your bones and really protect the integrity of your bone health, keeping them as strong as you can for as long as you can. All right, and I believe that we have another handout too with this lesson that's going to be called Balance, Posture, and Functional Exercises. So again, really thinking about improving our posture, working on our posture. When we improve the posture, we pull the shoulders back and sit up nice and tall, even in our chairs. Not only are we improving our posture and taking some of that stress off of our back and our spine, but we're giving our core a little bit of a workout too, because our core is supporting us and keeping us upright. So that's given kind of a double whammy or double your money, I guess, for giving you a little bit of a core workout, engaging those core muscles while also taking some of that stress off your spine. So that handout has a couple of really great posture activities that you can incorporate into your everyday routines. And again, you should be getting that if you haven't already after you before the next class, excuse me.
And they're good. I'm dropping them in the chat as you're
Perfect.
mentioning them. Mhm.
Perfect. Thank you, Wendy. All right. So now as we start to wrap up, let's start thinking about some of those goals and really focusing on SMART goals. What are some realistic and attainable goals that you can do this week to take care of your bones? And you take a few minutes to either put them in the chat, because it's always great to read what your goals are for this week when we talk about balance and reducing that fall risk in the home. But if you're a person that prefers that paper, and if you have that bone building steps worksheet, you can always write it down there and then put it to your fridge to help hold yourself accountable during the week. Yeah, it sounds like there's some great groups, some great comments again, or looks like there's great comments in the chat for everything. Does anybody want to share what their bone building steps will be for this week? Or any sort of goals they want to create for themselves when it comes to incorporating those balance exercises in for this week? And I'll be back next week to wrap us up with Wendy. So I'll be able to check in on y'all and make sure that you were able to meet your goals. Clear hallway clutter, that's a good one. Go to the gym. I like that. Good one, Amy. Just to even get to the gym and just reintroduce yourself to the gym and find some classes there. Again, not everything needs to be very high impact, especially if you do have osteoporosis or weakened bones. Find something that might be a little bit gentler, like Tai Chi, or even like chair yoga classes are a really great opportunity and great class too. Those posture exercises, again, even just something as simple as posture checks, maybe every hour if you are sitting on the couch or if you're sitting at the dinner table, quick little posture check to, pull your shoulders back and sit up nice and straight. And I feel like sometimes that really helps me, especially when I'm working in my office or on Zoom calls. It's nice to just, okay, quick posture check. Let's roll the shoulders back and sit up nice and straight. Melanie, I need to work on posture exercises too. So
I need to be intentional about it, like set reminders, to do that,
yeah, even if it's like little calendar reminders, if you're living by your Outlook calendar, even every hour, maybe have a quick little 5-minute spot that pops up to say posture check. That's walk at least 5 days a week. That's great. Be sure that you're holding your shoulders up and you're walking nice and tall. And when you're walking, being sure that you can see where you're walking, so there's no fall risk, hopefully, or you can avoid any obstacles. Do at least 20 minutes of strength and balance exercises 3 times next week. That's a great goal. That's a really great goal, Elizabeth. So yeah, be sure that you're writing these down. And again, we'll check in next week because I'll be back with Wendy next week to see how everyone did with those goals and what kind of obstacles they may had to overcome. So great goals, everybody. All right, are there any questions that we have about today's lesson or really anything that we've covered so far in the Build Your Bones series? Or really anything, any comments, any feedback, any words of encouragement? And as you guys are all thinking about questions or last minute questions here, I'll give you a sneak peek for next week's class. I kind of let the cat out of the bag already. But I believe it'll be Wendy and I will be presenting and wrapping up this session and really talking more about physical activity and safe physical activity for those who maybe are diagnosed with osteoporosis or are just looking to build their bone health, improve their bone health, and what types of exercises you want to do in order to do that. But yeah. But if there aren't any questions, certainly, we'll give you 16 minutes back to your day. I'll be on for a couple more minutes anyways. And if nothing else, Wendy and I will see you next week with the rest of the Build Your Bones team. Thank you for joining us this afternoon.